Good evening, everyone.
Good evening, Gita.
Good evening, ma'am.
So,
yeah, ma'am, please.
You can start, I think. 1 minute, 2 minutes is there, then you can start.
Okay, ma'am. Okay, thank you, ma'am. Okay. Once again, I wish good evening to all the participants and the resource persons and the portfolios of the Nursing Teachers Association of India. At the very beginning, I'm happy to announce you that we are able to organize a webinar on the occasion of nursing teachers, on the occasion of World Mental Health Day, on the theme of the World Mental Health Day, under the banner of Nursing Teachers Association of India. And in this regard, I would like to welcome all the members who are joining here. And especially, I would like to mention about Dr. Farooq Khan, sir, the President of Nursing Teachers Association of India, Dr. Manish Kumar, sir, Secretary, Nursing Teachers Association of India, or shortly we say NTAI, Dr. Gitumani Kaur, Madam, President, NTAI, Assam Branch, Dr. Bandana Devi, Madam, Secretary, NTAI, Assam Branch, Dr. Nirmali Gogoi, Madam, State Vice President, NTAI, Assam Branch, and all the resource persons, Madam Dr. Rachel Rao from Nagaland, Dr. Angshu Lama ma'am from Tezpur LGB-RIMH, Sir Mr. Sisir Kumar Gogoi from Jorhat, and Dr. Prakash Brahman sir from Guwahati, and all the participants who have joined this webinar that basically includes the different faculties of nursing and the students of nursing. So once again, I welcome you all, and now I give time to Dr. Rachel Au, who is the nursing faculty, School of Nursing, Kohima from Nagaland. Madam, time is over to you, and Madam is about to tell us regarding concept of mental health and illness. Thank you, ma'am.
Thank you, Madam Gita. My sincere gratitude to Nursing Teacher Association India Assam branch for having me today. The theme mental health is a universal human right. How true it is and how important it is to seek our rights. And to seek our rights, it is crucial we understand the concept of mental health and mental health conditions. When we talk about health, we do not only mean physical well-being, we also mean total well-being, which includes mental health. By good mental health, we understand that it is the ability to face any life-changing events without having any conflicts with our mental health. At the same time, sustain a positive attitudes and accomplish a perfect balance in one's thinking, feeling, and behavior. You see, our overall behavior, our personality is shaped by both physical and mental health. One definition on mental health, according to World Health Organization, is a state of well-being in which an individual realizes their abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. It is not merely the absence of mental disorder, but a positive state of mental and emotional well-being. You see, good mental health does not only confine to physical and mental health, it also refers to the ability to cope with our surroundings, our needs, and our desires of others. And that covers a wide range of good mental health indicators, like positive attitude towards self, the ability for self-actualization, our commitment, our joy, our ambition, ability to make independence, yes, autonomy, judgments, perception of reality, self-confidence, adaptability, taking responsibility, environmental mastery. These are all indicators of mental health. With all these indicators, we need to balance ourselves. If we fail to maintain the equilibrium, this may lead to mental illness. Mental illnesses are health conditions involving changes in emotion, thinking, or behavior. If we look at the history, the concept of mental illness has shifted with a drastic change from supernatural, somatogenic, psychogenic, to the concept of contagion that affects a person's thinking, feeling, and behavior. You see, poor mental health does not affect people in the same way. Rather, it affects us in different ways. In our lives, we experience ups and downs. We face many untold challenges, and sometimes we are unable to prevail, overcome such challenges. And this does not mean we are having a poor mental health. And having poor mental health does not mean we have a mental health conditions. You and I can experience low mood without living with depression, stressed out without having stress disorders, or be anxious without having an anxiety disorders. Mental conditions do not happen just with one factors. It develops due to a combination of many factors. Many factors are involved as like genetic, brain chemistry, environmental factors, social determinants of health, childhood experiences with trauma, abuse, stressful life situation, personality traits, substance misuse, and yes, other coexisting health conditions. Every one of us has mental health, but not everyone is presented with a diagnosis of mental illness. Mental illnesses are diagnosable of mental health conditions, and each mental health condition has its criteria to be diagnosed. Globally, there are two standardized systems for classifying mental disorder. The first classification is International Classification of Diseases, ICD-10, developed and published by World Health Organization. This is international standard diagnostic classification for a wide variety of health conditions. The WHO has revised ICD-10 to produce the latest version of international classification. This is ICD-11, adopted by the 72 World Health Assembly in 2019 and came into effect on 1st January 2022. And the second is Diagnostic and Statistical Manual of Mental Disorder, DSM-5, developed and published by the American Psychiatric Association. When we talk about prevalence of mental disorder, mental health conditions are beyond belief, common in the whole wide world. Mental illness is increasing at an alarming rate everywhere. India is dealing with high prevalence of mental disorders. According to the World Health Organization, about 20% of India will suffer from mental diseases by the end of 2023. And WHO statistics shows the average rate in India is 10.9 for every lakh people. In Nagaland, statistic itself shows more than 20,000 are suffering from severe mental illness, and the acceleration cases in anxiety, depression, sleep disorders, stress, grief with suicidal ideation is at alarming rate and high prevalence among female. Poor mental health is the biggest cause of ill health. Mental illness can affect anyone, regardless of age, sex, religion, socioeconomic status. All ages are susceptible, but the young and the old are chiefly vulnerable. If mental health conditions left untreated, this will lead to a huge impact on our day-to-day living and can worsen the mental health conditions and can have a negative impact in our community. The burden of mental health conditions is a burning issue in community as a whole, which is one leading factor reducing the quality of life, the standard of life, and impact in socioeconomic and access to mental and healthcare remain a significant concern and a challenge to healthcare profession. With these concept notes, I would like to encourage each and every one of us that mental health awareness should be recognized, must address, and should disseminate and propagated laboriously as a human rights. Thank you. Madam Gita, over to you.
Yeah. Thank you so much, Madam Dr. Rachel. Madam, very beautifully you have oriented us with the concept of mental health and illness, that also in a very short period of time. Thank you so much once again. So now I request the participants to clear their doubts or to clear if they have any queries. Madam Dr. Rachel Lau is with us. So I give few minutes, 1 minute time to the participants for clearing any doubts if you have. Thank you. Okay, so like again, as we have a very short period of time in our hand, we'll not wait as we do not have any queries. So we'll move to the next topic of our today's webinar. And if the participants have any doubts, you can keep a note on it. And at the end of the session, we can have discussion on it. So I request Madam Dr. Angshu Lama, who is working as an assistant professor at LGBRIMH Tejpur under National Mental Health Program, to talk on the topic issues related to mental illness. So, Madam, it's over to you. Thank you.
Thank you, Mrs. Geeta Vaishya, for giving me this opportunity to talk on the issues which are related to mental illness.
Excuse me, madam. Madam, your volume is very low.
Okay, just once. Can you hear me now?
Yeah, little better.
Hello, can you hear me?
Yes, we can hear you. But it needs little bit more louder.
The speaker, probably. Can
Okay.
it be done?
Okay, ma'am. Yeah.
Okay. So what happens is today, like this is a very important topic that has been given to me, that is the issues which are related to mental illness. Like as we know, when we call mental illness, it encompasses a wide range of conditions, and there are a lot of challenges that affects an individual's emotional, psychological, and social well-being. So, and there are certain very important issues which we encounter in our day-to-day lives, not only in the hospital, but also in our own family, in our neighbors, in our community. And that is first and foremost is the stigma and the discrimination regarding mental illness. So now also in our community, stigma, this is one of the biggest issue. And people with mental illness, they face a lot of discrimination because first, that like that day I was watching a video in which they say that how can a person who has got so much of like name and fame suffer from depression? So why cannot? So the question is that the stigma is there that people who have got name and fame cannot suffer from depression, or there's a shyness that probably that if people come to know that we have mental illness, then they will discriminate us. So the stigma and discrimination is one biggest factor which we need to overcome. And because of the stigma and the discrimination, a lot of people, they are not getting the treatment which they are supposed to be getting. Like in our hospitals also, they do bring to us, but they do not come for follow-up because they are in the idea that if the people come to know about their illness, then either they will be taken out from the job, they'll be taken out from the schools, or the friends, they may discriminate them. So this is one issue. The second issue which we always face is the accessibility to treatment. Of course, with the National Mental Health Program and the District Mental Health Program, the government has done a lot to provide the treatment as nearest as possible to the people, but still many individuals, they lack access to adequate mental health care, including the therapy and medications. And this can be due to the financial barriers, limited availability of services, and lack of awareness, because treatment comes at a cost. And we have always seen that it's a vice versa effect, that most of the people with mental illness, they have disabilities due to which they have socioeconomic problems, or because of the illness they have socioeconomic problems, or because of the socioeconomic problems they have the mental illness. So due to which they cannot get the treatment the way they're supposed to be getting. Then the lack of awareness is that till now people, they go to the Kobiraj, the local faith healers, they're still not aware that mental illness, like for example, like in our community, whenever a person is having a headache or some sort of somatoform disorder, they take them first to the local faith healers, then they come to our hospital. So the awareness is very important among us, and mental health in the workplace is very important. Like this is also one issue with the law, like it's become a rat race nowadays. Everyone is in a competition, like everyone is in a competition, then that to climb the ladder first, because of which that the target is there, they have the deadlines are there. So this leads to a lot of stress, and this stress is one major factor which may lead to mental illness in a person. So this in the workplace, the mental well-being is very important. So that's what the government of India has also started with many plans and policies to improve the mental well-being of the people in the workplace. And of course, the co-occurring disorders, like as we know, like due to the illness, the person may have mental illness. Like for example, if I'm suffering from diabetes mellitus, or say hypertension or some chronic illness, I may suffer from depression. Or the other way around, because I'm having schizophrenia and the medications which I'm getting, the side effects of the medication may lead to other forms of physical illness. So this physical disorder which is being caused by the medications is a barrier in the person's treatment. So they say that because I'm having the side effects, I don't want to take these medications anymore. And when the person does not adhere to those medications, then it becomes a huge challenge for the treating team in taking care of the patients. And one very important issue which all of us we are seeing every day in the newspapers, in the news every day, that is suicide. Suicide, say it's co-occurring, we can say. It's a very big issue in this area of mental well-being. Suicide can occur due to depression. Suicide can also occur as a symptom. Say, for example, a person who's suffering from schizophrenia may be having auditory hallucinations, the commanding type. Like, say, he may get a hallucination, the voice is commanding him to jump from somewhere, cut himself, slit himself. Like we do get cases in the hospital where they have harmed themselves. Physically, they have harmed themselves. So the suicide is a big issue, which is also needs to be taken care of when we are taking care of patients. And mental illness, of course, has a big burden to the families. It's a socioeconomic burden is that the government, the public sector, the private sector, the family members in taking care of the person with mental illness is, of course, has a huge economic burden. And it has a huge impact on the family members also, because it can have a significant impact on the family members and the caregivers, because they also often have to face a lot of challenges in providing them care. And there's a lot of stress, there's a lot of coping, and like sometimes the patients, they are dangerous to themselves as well as to others. Like we get cases where patients, they've burnt the entire house out of some symptoms, or due to the symptoms they have gone and beaten someone, they become violent, they become aggressive, and taking care of them is a huge stress. And meeting their financial needs is a big stress. Taking care of a person with mental illness itself, we can understand how big a challenge it is for the family members. And nowadays we have to also take care of the children and the adolescents. Normally what we say, a small child, how can he have a mental health issue? Why not? Why cannot a child have a mental health issue? So children and adolescents, early intervention is very important. Like the early exposure, nowadays we see multimedia, the mobile phones, gaming, these have become an addiction, we can say. It's not a substance, but mobile phone, this multimedia, social media, these have become an addiction, and our children, especially the adolescent groups, they are becoming the victims of it. And I guess all of us, we are coming to see these things in the news also every day. And homelessness due to poverty, as I've already mentioned earlier, homelessness is also one very big issue related to mental illness. So it is very important for all of us to address all these issues through education. So education is one very important thing. Going to the community, educating them about mental health. So communication, education, and awareness programs, these are very important. And of course, destigmatization. It is only through the education and awareness programs can we destigmatize mental illness. And advocacy is very important, and ensure that individuals with mental health conditions receive the support and the care that they require. So with this, I would like to end my talk on issues. Of course, there are many more issues. In this 10 minutes of time, but still, I'm open to any questions if anybody wants to. Thank you so much. Like over here, I would also like to talk about recovery. Like mental illness, like I always get questions, you know, when the patients come to us, they ask us, Baido, kiman din dorab khabo lagibo? Gutei jibon khabo lagibo ne? So the recovery, so mental illness, it covers a various areas. Loli Raja, can you kindly mute yourself, please? Loli Raja, please, can you mute yourself? Yes. Am I audible?
Yeah, ma'am. Yes, ma'am, you are audible.
Yes. So this recovery period, there's no surety guarantee that how long a person may take to recover, and that becomes a huge burden for the family members in taking care of the patients. Loli Raja, please mute yourself. Loli Raja, please mute yourself. It's very disturbing. Yes, please. Thank you. So what happens is it becomes a huge burden for the family members in taking care of them, because it is stressful in taking care of, say, even if one member of the family is suffering from mental illness, bringing that person for regular checkup, taking care of that person, of course, buying those medications also, regular follow-ups, treatment, it is, and the symptoms associated with the illness and the stress. So what happens is the family members, they want to know how early. And when they come to know this is going to be very long, then they just leave it. So this is what I can say. Thank you so much.
Thank you so much, Madam Dr. Anshulama. So you have highlighted the different issues related to mental illness in different aspects in a very comprehensive way. Thank you so much, ma'am. And it is a very huge topic, and again, covering it in such a short duration is not easy for you, that I understand. So anyway, I request the participants to note their queries addressed at the end of the session. So we would like to move to the next topic of today's session. Thank you once again, Madam Dr. Anshulama. So now I request Sir Mr. Sisir Kumar Gogoi, who is the Vice Principal and also the Assistant Professor of Jorhat Law College. Sir is going to talk on the topic human rights of mentally ill person and laws related to mental illness. Sir, the time is over to you.
Can you hear me? Hello?
Yes, sir.
Yes,
sir.
Oh, thank you for giving me such a wonderful opportunity. So I'll briefly explain. We know that the convention, we may call it treaty or charter, that was passed, known as Convention on Rights of Persons with Disability by the United Nations General Assembly in 2006. And India, being a responsible country, also a founder member of UNO, India actually signed it and ratified it. And in compliance of it, the Parliament of India enacted the Mental Health Care Act. So I'll explain. So since I have a sort of time, that Convention on Rights of Persons with Disabilities basically explain and that the meaning of disabilities is that basic purpose of that convention is to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote respect for their inherent dignity. That is Article 1. And it also specified that persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairment, which in interaction with the various barriers may hinder their full and effective participation in society on an equal basis with others. So international community, UNO, international charter, even the whole world community recognize the human rights of such persons. Basically, they belong to the vulnerable groups. Now I will come to India. we have many laws on this topic, but I'll briefly explain since I have short of time and I have to discuss any topic, particularly on a law, I need time. But however, I will discuss. We know that India is a vastly populated country, more than 1.4 billion people. And we have a report, and according to that report, 1 in 7 Indians actually affected. They are affected by the mental disorder of varying severity, and they are in a vulnerable positions, and they are known as the vulnerable groups. And our legal system, we know that our legal system, our constitution, all are based on British system. And before independence, the British actually enacted several laws. I will cite briefly Lunacy Act of 1858, the Lunacy Act, Supreme Court Act 1858, the Indian Lunatic Asylum Act 1858, the Military Lunatic Act 1877. But these acts were enacted in the 19th century, and today I will discuss the 20th century law. We know that after Second World War, especially that of that Holocaust or the brutal execution of Jews, massacres of innocent people in Europe and across the world by Axis, we know that United Nations organization was formed, and main object of United Nations organization was to promote human rights. And in 1948, the Universal Declaration of Human Rights was adopted by the General Assembly. And though it is a fact that the Universal Declaration of Human Rights cannot be enforced, yes, but these have great academic values. And now we come to our constitution. In 1949, on that day, 26 November, our constitution was adopted. And fundamental rights, these fundamental rights are basically human rights, and especially on the rights of those persons with disabilities. We may not have a specific provision, but because of judicial interpretation, that I mean the expansive interpretation of our fundamental rights, especially the Article 21 of the Constitution, which says that no person shall be deprived of his life and personal liberty except according to procedure established by law. So we may say that that person with disabilities or they have human rights, and under Article 21, they have human rights, and I will explain some provisions. And we know that in consonance with the United Nations Charter, our Parliament actually enacted the Mental Health Care Act in the year 2017. Though bill was ratified, I mean, by the Rajya Sabha in 2013. So the Mental Health Care Act 2017 is a landmark legislation as far as the rights of these vulnerable groups are concerned. The preamble of this act says that the main aims to provide mental health care and service for these peoples and to promote the right of such person during delivery of mental health care and services. This act is progressive, patient-centric, and right-based. And Chapter 5 of this act says that rights of person with the mental illness is the head and heart of the statutory legislation. So this act enacted by our Parliament basically defines mental illness as a substantial disorder of thinking, mood, perception, orientation, or memory that grossly impairs judgment, behavior, capacity to recognize reality, or ability to meet the ordinary demands of life, mental condition associated with the abuse of alcohol and drugs, but does not include mental retardation, which is a condition of arrested or incomplete development of mind of a person, especially characterized by subnormality of intelligence. I beg your pardon because I have to speak in that way, but now I will speak rights, basically rights of such persons, the rights under the Mental Health Care Act. First right is that has been recognized, right to access healthcare services, right to access healthcare services. Next, right to free of cost of healthcare services. Next, right to live in a community. Next, we may say that right to protection from cruel, inhuman, and degrading treatment. Right not to be treated as prohibited treatment. Right to equality and non-discrimination. Right to information. Right to confidentiality, and right to legal aid. The right to free legal aid is recognized by Article 39A of the Constitution. It's a part of GST principles of the state policy. Now, I will explain. But there are some disabilities, and such rights cannot be conferred to the person
Hello?
with. Yes. First is that. Yes, please. Mute, please. First is that such persons are not allowed to enter into a contract. Such persons cannot enter into a contract. Next, why? Because for every contract, we know that the valid consent is an essential requirement, and such persons are incapable. Next, right to marry. They have no human rights or fundamental rights to marry. Even if marriage is solemnized with such person, then it will be void, and they have no right to cast their vote or hold public office, and they cannot make any will. And last point is the most important. We know that law means crime. Criminal law is the most important aspect, and they are not to be held liable for a criminal offense. That is, and I will require time, but Indian Penal Code 1860 actually exempt person with unsound mind from criminal liability. But we have to distinguish between what is medical unsoundness of mind and legal unsoundness of mind. These two are extremely difficult topic. And next, I will discuss some some judgment very briefly. So, on the rights of such person. So basically, now our constitution, our legal system, in consonance with the international community or UN Charter, has recognized rights, basic human rights, because you know that human rights are inalienable. Every human being is born with such rights, like LGBT rights. Such persons have also rights. I am using that term. Such person with disabilities. Yes. Now I'll briefly discuss a landmark judicial decision. I mean judgment. I will not mention the name of the case. I will only use that accused X versus State of Maharashtra. This was decided in the year 2019. It is one of the landmark judgment of the Supreme Court. So I'll briefly cite this case. The accused was charged with the murder of two minor girls, and the trial court found them guilty. We know that in India, the trial courts are empowered to award death sentence only in rarest of rare case. The Supreme Court of India in 1980 actually gave us that doctrine that only in rarest of rare case, I mean only in extreme cases, death sentence can be awarded, and it was awarded. And High Court also confirmed, I mean agreed with the trial court judgment, and Supreme Court too confirms that judgment. And revision petitions have been filed, but the Supreme Court dismissed. But what happened? We know that in India, though the court passed death sentence, but it requires time. Normally, you see, after delivery of judgment, that means a person against whom death sentence has been passed, such person has to wait for a long time, sometimes 10 years, 5 years. In this case, such thing happened. What happened? That person, I am not mentioning the name, against whom death sentence was passed, he was to be executed. Supreme Court confirmed, but he had to wait for 17 long years. 17 long years. It was too long. And what happened? Since we try to understand the mental agony of that person who was awaiting death sentence for 17 long years, and later he actually became a mentally ill person. So now what happened? Can a court, that is called post-conviction insanity, I am using that term, insanity, can that person be hanged? And the matter again reached Supreme Court. And Supreme Court fortunately reduced that sentence. I mean, not reduced, actually commuted. His death sentence was commuted to the life imprisonment. In Assam, we have such case. I am not going to mention the name of the accused. The accused was found guilty of murder of one person, And for 20 years, I think that person was languishing in Jorhat jail. He was awaiting death sentence. And later, actually, his mental condition have deteriorated. And fortunately, the Guwahati High Court commuted his death sentence to life imprisonment. So we have so many judgments. Since I have a since I am coming from legal background, so I will have to explain the judgment and law provision, basically law, and we have that medical insanity and legal insanity. These are too difficult to discuss here. But now, lastly, but not the least, I will discuss some important cases very briefly. And there are many cases, especially on Silabhar's case. And in one case, what happened in West Bengal, you know that in human rights condition of this person actually are not good. Basically, you see the mentally such person, mentally ill person, or we may say this person have been kept in a very inhuman condition. We try to remember in Calcutta what happened because of fire. 26 such person actually died in 2000. I think I'm trying to remember that year, maybe 2008. And this was the most inhuman and tragic incident. And court had taken notice of it. And accordingly, West Bengal government was penalized for such criminal negligence. Now, to come to that point, since our Supreme Court, our legal system, all have recognized the human rights of such person. I'm only using that such person in legal terms. Some actually in legal language, we should not use some terms. We instead, I am using that term vulnerable groups. Vulnerable groups. I beg your pardon. So vulnerable groups should be treated humanly, and even we know that legally, constitutionally, that electric shock, what is called electric the convulsion, now that is banned, totally banned. That cannot be given to treat such person. They are to be treated. Of course, our system is not so robust, unlike Western countries, British, Americans, the Canadian, Australians, all have actually far ahead of us. Still, we are struggling to deal with such vulnerable groups. And I hope that system shall improve. And constitutionally, our Supreme Court has been doing more than enough to uplift, to protect their interests. Even today, several petitions, in the last year, several petitions have been filed actually to uplift their human rights. And I hope the state will take notice of it and take all the necessary steps to promote their human rights. And with this, I am going to conclude my short speech. Thank you. Hello? Yes?
Hello?
Yes,
Yeah,
I
sir,
have concluded.
Thank you
Yes,
so much,
yes.
sir.
Yes.
Sir,
Thank you. Thank you.
Thank you, sir. Thank you. Sir, actually, we the nurses, we like when you talk about the legal aspects, we find it
Yes,
very
yes.
tough, or many a times
Yes,
we
yes,
find
yes.
it boring.
Yes, yes.
We
Yes,
like to talk
yes, yes.
about the other clinical aspects, which is always interesting for us. But when you were telling us about the different cases, it was really very, very interesting for all of us.
Yes.
And all the
Actually, madam,
participants-
Madam, there are many cases. Actually, to explain it within a short period of time, it is extremely difficult. So that's why I have I am only giving you some hints, basically. I hope that I will get time to discuss with all of you, and it will be a privilege for me.
Yes, sir. Anyway, it was very interesting to know from you about the different cases. Thank you
Yes.
once again. So
Thank you, madam.
now we'd like to move to the next topic, which is going to be addressed by Dr. Prakash Burman sir, who is a MD psychiatrist and also a consultant at National Health Mission Assam. And sir is already with us. I think the topic for sir is raising awareness on mental health services and scope. Sir, I welcome you to address the issue. It's over to you, sir. Thank you.
Thank you. Good evening, everyone. So I am Dr. Prakash Burman. I'm working as a consultant for National Mental Health Program under NHM. And I like to thank the organizing committee members of the Nursing Teachers Association India for giving me this opportunity to discuss regarding mental health. So today my topic is regarding the raising awareness regarding mental health, and the way ahead. So coming back to this topic, before moving forward, I would like to mention again, which you already know, that today, yesterday, the 10th of October, is celebrated as the World Mental Health Day. And the World Mental Health Day initially was started in 1992 on the initiative of the World Federation for Mental Health. And this day was celebrated, and it was started to educate about the mental health, to create awareness and advocate against social stigma. Now, the theme of this year of World Mental Health Day is mental health is a universal human rights. So mental health is a universal human rights. What does it imply? It implies that every individual has a fundamental right to access free mental health care services by the government. So this implication is very huge actually. So there is a saying that the morality, it's a kind of morality that we have to provide mental health care service to everyone free of cost. So it's a kind of moral situation, and morality has to go along with the capacity actually. So at present, the government machinery, it is not completely, it is not fully equipped to provide or to give this human right, to provide this human right. The government is not actually fully equipped with it because of the lack of mainly the human resources. So anyway, this human rights subject, it was amended in 2017 by the Mental Health Care Act. The government notified this Mental Health Care Act in 2017, and it was superseded. It superseded the Mental Health Act of 1987. In the 1987, the human rights of the mentally ill patient was not given priority, which was amended in 2017, and the resulting act, which was named the Mental Health Care Act. So the act, it was notified, or it was enacted to fulfill the India's international obligation regarding the Convention on the Rights of the Persons with Disabilities. So this point is important. You should, everyone should know about this. So anyway, coming back to my topic, to raise awareness. So I will not go into the details of why we should, we need awareness, because everybody knows there is a stigma associated and discrimination associated with mental health. So how to raise the awareness in society regarding mental health? The first point to raise awareness regarding mental health, we just have to do only one thing. We have to openly talk about it, because of the associated stigma, nobody talks it openly. And even if anybody is suffering from something, he suffers inside. নিজৰ ভিতৰতে ভুগি থকা যায়, এটা openly কথাটো নকয়. So the first point which we should remember, that we should talk about mental health openly. Okay, so when we will talk it, and আমি যদি কমন ল্যাঙ্গুৱেজত এটো ব্যৱহাৰ কৰি থাকো মেন্টাল হেলথ ৰিলেটেড সাবজেক্টটো, ডে টু ডে লাইফ ডে টু ডে এক্টিভিটিজত আমি মেন্টাল হেলথৰ বিষয়ে কথা পাতো, আমি নিজকে এক্সপ্ৰেছ কৰো, তেতিয়া হলেহে ইয়াৰ যোনটো মানে স্টিগমা এছ'চিয়েটেড হৈ আছে বা ডিসক্রিমিনেশন যোনটো মেন্টালি ইল মানুহৰ লগত সোসাইটিয়ে কৰে, এটো লাহে লাহে কমিব. The first thing regarding raising of awareness is to talk about it. Okay, so the next step to raise awareness about mental health, the next step is we have to remove the myths associated with mental health. মেণ্টেল হেলথৰ লগত যোনবিলাক আমাৰ ভুল ধাৰণাবিলাক আছে আমি সেইখিনি এড্ৰেছ কৰিব লাগিব যেনেকৈ বৰ্তমান সমাজত যোনটো ভুল ধাৰণা হ'ল যে মেণ্টেল হেলথ ইজ কজ বাই ইভিল স্পিৰিট ভূতে ধৰিছে বা হাৱা লাগছে এনেকুৱা ধৰণৰ কথা আমাৰ সমাজত আছে কাৰোবাৰ যদি বিহেভিয়াৰেল চেঞ্জ হয় কোনোবা যদি মেণ্টেলি ইল হৈ যায় তেতিয়া আমাৰ এই মিথটো এই ভুল ধাৰণাটো সমাজৰ মাজত বিয়পি যায় যে মেণ্টেল ইলনেছ ইজ কজ বাই ইভিল স্পিৰিট সো আমি সেইটো এড্ৰেছ কৰিব লাগিব নেক্সট এটা মিথ আছে যে টু টক এবাউট মেণ্টেল হেলথ to talk about suicidal ideation it increases the chances of having mental illness or suicide eto eta myth hoy je ami kotha patile etu badhi jabo pare so ei point to ami address koribo lage boronso kotha patile ami identify he koribo parim aru early identification jodi ami koribo paru je manu ejonor mental illness or eta tendency ase then ami tak intervention dile he easily recover he hobe so this myth that talking about mental illness or talking about having suicidal ideation increases the chances of mental illness or suicidal ideation is a myth and we should address this. The next thing is the next myth which commonly everybody thinks that mental illness only occurs in mentally weak people. দুৰ্বল মানসিক মানুহৰ মানসিকভাৱে যোন মানুহ দুৰ্বল হয় তেওঁলোকৰহে মানসিক বিকাৰ বা মানসিক ৰোগ হয় এটো এটা মিথ হয় এটো ভুল ধাৰণা যি কোনো মানুহৰ হ'ব পাৰে মানসিকভাৱে বহুত ষ্ট্ৰং মানুহৰো মেণ্টেল ইলনেছ হৈ যাব পাৰে পৰিস্থিতিত পৰি কিনে সো দিস ইজ ওয়ান অফ দ্য মিথ উই শুড ৰিমেম্বাৰ ইট আৰু এটো আমি প্ৰপেগেট কৰিব লাগে দ্য নেক্সট থিং ইজ মানুহে ভাবে যে মেণ্টেল ইলনেছৰ কাৰণে যদি আমি ট্ৰিটমেন্ট লওঁ বিশেষকৈ মেডিসিন লওঁ তেনেহলে একবাৰ মেডিসিন স্টার্ট কৰিলে এই মেডিসিনটো আমি লাইফ লং লৈ থাকিব লাগে বা আমি লাইফ লং এডিক্টেড হৈ যাম সো মেনি এ টাইমস মেন্টালি ইল হোৱাৰ পিছতো ডায়াগনোসিস হোৱাৰ পিছতো মানে মেডিসিনটো নলয় কমপ্লায়েন্সটো নাথাকে এই যে মিথ আছে ভুল ধাৰণা আছে যে মেডিসিনটো একবাৰ ললে এটো বন্ধ কৰিব নোৱাৰো লাইফ লং এডিকশন হৈ যাব সো দিস মিথ হ্যাজ টু বি এড্ৰেছড সো দিস ইজ অ্যানাদার ওয়ান দেন only marriage cures mental illness this is another myth বিয়া পাতিলে মানুহৰ স্কিজোফ্ৰেনিয়া ভাল হৈ যাব বিয়া পাতিলে ডিপ্ৰেছন ভাল হৈ যাব এনেকুৱা ধৰণৰ এটা ভুল ধাৰণা সমাজত আছে হেতু একেবাৰে মিথ্যা হয় আমি এটো প্ৰপেগেট কৰিব লাগে যে বিয়া মানসিক ৰোগৰ ট্ৰিটমেন্ট নহয় আমি মানসিক ৰোগৰ যোনটো এপ্ৰোপ্ৰিয়েট ট্ৰিটমেন্ট হেতু লব লাগে বিয়া পাতিলে উল্টা মানসিক ৰোগটো বাঢ়িহে যাব পাৰে এটো মনত ৰাখিব আৰু এটা মিথ আছে মানুহে মিথ নহয় এক্স্যাক্টলি মানুহে ভাবে যে স্ট্ৰেছ হলেহে বা স্ট্ৰেছ এড্ৰেছ কৰিলে মেণ্টেল ইলনেছটো ঠিক হ'ব যে মেণ্টেল ইলনেছ ইজ অনলি এবাউট স্ট্ৰেছ ইট ইজ নট সো মেণ্টেল ইলনেছৰ বহুত কাৰণ থাকে so okay so mental illness have many causes it is not only about stress it starts from biological reasons familial reasons or genetic causes any disease have three things one is environment one is agent one is host same applies to mental illness so biological ba hostor juntu eta factor ase that mental illness may be having genetic basis or familial basis one thing then environmental causes many a time the life situations immediate stressors life events they create a kind of emotional imbalance so this may be a contributing factor for the development of mental illness then another is host mane hol the individual susceptibility one individual may be genetically susceptible to having mental illness so a susceptible individual when exposed to an environment of stress and other things then he is prone to develop mental illness so these are some of the myths which should be addressed to raise awareness regarding mental health now to create or to raise awareness regarding mental health the third point is to talk about or to create awareness regarding the signs and symptoms of mental illness so mental illness or junblak signs and symptoms all those are limited to the behavioral changes mainly the behavioral changes and the cognitive changes okay and the biological changes. So biological changes of ki hobo, the biological changes like our sleep patterns will change. If the sleep patterns have changed from the last few days, like the person is either sleeping too much or sleeping very little, then either he is hypersomniac or he is insomniac, then this is a sign of mental illness. So biological factor has the biological aspects have been hampered, and the other biological aspect is the appetite. Appetite may increase or appetite may decrease. Both are symptoms of mental illness. Then another is bowel movements and bladder movements. For example, if a person is holding his urine, holding his saliva for many days, for hours and hours, he is holding his saliva, for hours and hours, he is holding his urine, he is not passing urine, he is not spitting his saliva out, then we may think that person is having some kind of mental illness. Then another is, this were the biological aspect. Then the next aspect is the behavioral aspect. If the person has sudden behavioral changes, a previously docile person having aggressive outburst, or is being very, very happy, is singing and dancing and running in the streets, then these are some of the behavioral changes which can be seen. Then another behavior change is that the person is always in the recent, from last few weeks or days, he may be having these expressions that he is feeling very too much of anger, he is feeling too much of sadness, or he is feeling too much of happiness. Sudden changes in the mood of the person. If he is feeling sudden development of having low moods, or suddenly develop high mood means he is having euphoria, or he is having too much of anger outbursts, then this is a sign of behavior change. Then cognitive aspects may change. A previously intelligent person gradually losing his memory, gradually losing his skills, is a sign of mental illness. So the third point, that is, we should raise awareness regarding the signs and symptoms of mental illness. Another aspect of raising awareness regarding mental illness is to propagate factually correct data. Many a times we scroll through our these social media pages like Facebook, and whatever message we get, we forward it. We do not care to check the authenticity of the messages. So as a society, as an individual, it is our duty to factually examine the data, whether it is factually correct, and then only we should propagate such messages regarding mental health which is factually correct. So this is the fourth point. Then another point is to be mindful of our surroundings and to be mindful of our own emotions. Okay, so we should know in what situation a person may react, in which kind of way. So this kind of mindfulness is required. So as an individual, we have a duty to be acting like a gatekeeper. Okay, for example, a person is standing on a borderline of depression where he is about to commit suicide. So as a person, if we can identify such person, then we should be a gatekeeper. We should act like the gatekeeper and stop that person, convince that person, and refer that person to the appropriate authorities so that it can be managed or treated. So as an individual, we have this duty to be a gatekeeper, and we should remember one mnemonic. The mnemonic is QPR. As a gatekeeper, we should remember only three things, that is QPR. The Q is question. A person, if he is showing changes of behavior or his cognitive abilities, you should ask, are you suffering, or are you feeling bad? Are you feeling happy, or are you feeling very angry? Are you having suicidal thoughts? We should ask or question that person. After questioning, if we suspect that the person may be having some kind of suicidal ideation or other things, then we should persuade the person, and we should convince the person that whatever you are going through, it may be a sign of mental illness. And so you should, for the time being, stop whatever you are doing and consult a appropriate mental health professional like counselor or a psychologist or a psychiatric nurse or a psychiatrist. Then after persuading, the next thing is R, refer. So you should refer the person after convincing it to the appropriate authority. Okay. Then for propagating the previous point which I mentioned, I forgot to mention one thing, that we should propagate factually correct thing or information. Another thing is we should teach our children regarding some of the core life skills. The core life skills which were enumerated by World Health Organization. These are your self-awareness, empathy, critical thinking, creative thinking, decision making, then your effective communication, interpersonal relationship, coping effectively with stress, and coping effectively with emotions. These are some of the core life skills which should be taught to our children by our teacher, by the society, or as an individual. We should try and teach our children regarding these life skills, so that when they grew up to be the adult, they can handle their emotions, or they can handle their stress, and they can handle the day-to-day activities of the society effectively, and the incidences of mental illness in those cases will drastically reduce. Now coming to the government services. Next point, I will talk about the government services which are available for mental health and the mental ill patients. So there are many programs which address this mental health issue. The number one program is National Mental Health Program, and under this program, District Mental Health Program is running. So National Mental Health Program, it was launched in 1982, and in Assam it was started in 1996 in the district of Goalpara and Nagaon. So under the District Mental Health Program, we have few human resources. The number one is a district program officer who is a psychiatrist or a trained medical officer who is trained in psychiatry. So one psychiatrist, one clinical psychologist, one psychiatric social worker, one community nurse, one psychiatric nurse. These are the requirement of a district mental health program. So in Assam currently, district mental health program is running in all the districts. However, few of the districts don't have the human resources. So anyway, so district mental health program, they provide OPD services regarding mental health and mental illness. They also provide IPD services in many districts, and wherever the district mental health program which works in the district hospital wherever it is not there a medical college is there. So in all the medical colleges, the Department of Psychiatry is active. So for any kind of mental health related issues, you can contact those department. Now, the DMHP, the District Mental Health Program, also conducts outreach activities. These are called target intervention camps in the block, PHCs, and other sub-centers, and in the communities. There, the team goes and screen people. They talk about mental health. They create awareness regarding mental health, and they refer the identified person to the district hospital or the or the medical colleges, and also provide on-spot treatment, the basic first aid treatment. Okay. Then the district mental health program is also working in the area of IEC, that is information to raise awareness regarding mental health. The second program which has recently come up, the second program under government which has recently come up is Telemanas. So Telemanas, it is under National Telemental Health Program. Telemanas is a helpline. Like 108, 104, Telemanas is a helpline whose short code, the number is 14416. Telemanas helpline 14416 is a helpline which caters to the requirements of mental health. For any kind of advice or counseling, you can contact in this number. There are counselors and psychiatrists. So when you dial this number, a counselor will pick up the phone. You speak about your problem, the counselor will give the basic counseling, and if the counselor thinks or diagnose that the person requires higher intervention, then the call is diverted to a psychiatrist or a mental health professionals. So this is the service being provided by the government at present, and this service can be availed through any mobile. You just have to dial 14416 and it can be accessed wherever the network is there. So first, this is the phase 1 running in Telemanas, where we provide the advice and counseling regarding mental health and mental illness. In the second phase, which may come up in the later part of the next year, where the Telemanas service will also provide e-prescription, audio-visual consultation with psychiatrist also in the next phase. So Telemanas has come up last year and it is functioning now. You can note down the number 14416 for any kind of mental health related queries or issues. You can dial this number. Now another program I would like to talk about is Rashtriya Kishore Swasthya Karyakram. Under Rashtriya Kishore Swasthya Karyakram, there is another sub program under this program. It is called School Health and Wellness Program, where the mental health related topics are taught to the teachers, and the teachers in turn teach their students. So in this way, the mental health awareness is being imparted by the government to the society. So another program is there, that is Rashtriya Bal Swasthya Karyakram. So under RBSK, a team of professionals go to the school in the block level and screen the children regarding illness, where they also identify children in the adolescent age group having mental health issues, and when identified, these children are referred to the nearby district hospital or the block PHC, where the mental health service is available. And they also create awareness regarding the helpline Telemanas, and on then and there itself, the student can, with the help of the teacher or the professional, can dial this number and get counseling regarding his issues. Okay, so these are some of the government services which are available. Another government service which is available I would like to talk about is regarding the disabled. So there are some mental health diagnoses like the schizophrenia, mental retardation, then bipolar affective disorder in severe cases. So these are some of the diagnoses where the patient is technically termed disabled, or technically he becomes disabled. So for such kind of patients, the Social Justice Department have a scheme where monthly pension of 1,000 rupees is being given. So to avail this service, you just have to go to the Joint Director office and fill up a form. There is a portal also where you can apply in the form, but anyway, you have to visit the Joint Director office, where the form will be downloaded and given to you, and a psychiatrist will be assigned to the person having this mental illness, and the psychiatrist will certify that the person is having this much of disability and is eligible for the monthly pension. When the psychiatrist certifies, after that, after submission of this form to the Social Justice Department, the person gets this relief from the government. So these were some of the government services. So, I will stop now, end my talk here itself because of the constraints of time. So any question if you have, we can discuss in the open discussion. Thank you.
Thank you so much, sir. It was very wonderful and very interesting to listen to you. And very beautifully, you have enlightened us with the theme of the World Mental Health Day. And in a very interesting way, you have detailed us with the in-depth and updated information about the topic given to you. Thank you so much. I think all the participants are enjoying, sir. Till now, 91 participants are continuously attending and listening to the speakers. So we are happy to see that. So now it's time for open discussion. I request all the participants to raise your queries. So we are here. You can text your queries.
Uh,
Yes, you can also
speaker. Yeah.
you can
I have just
yeah.
for Dr. Podcast. Are you audible? Are you audible?
Yes, yes, you are audible. Yes, you are
Yeah.
audible.
Mental really so very informative talks from all the speakers. We learn a lot of things. But I have just note of that so many precipitating factors of the mental health. Yes. Yeah, that factors as a doctor, if you find out the factors which are exhibiting the mental problems, if you eliminate exact precipitating factor, is it possible to completely cure the problem? Are you got my question?
Yes, I got your question that you are asking whether if we can identify the exact cause
The
which
cause.
led to the mental illness, then can we treat that cause and the mental illness will be completely cured? That is your question, no?
Yes, yes.
Okay.
Yes.
So
That
actually,
the factors. Cause means that factors, because so many environmental factors or so many factors are there. If that particular factors, because of that particular factors, that person is suffering the mental problems. If you find out, you eliminate that. If you eliminate that problem, that factors, is it possible to cure?
okay, so the by factor, I think you are referring to the life events or the stressors in the life of the person. Am I right?
Yes. Yes. Yes.
Okay. So regarding that, uh, after the mental illness has developed, for example, clinical depression, it is in technical term, it is called major depressive disorder. And another term is bipolar affective disorder. Then another point is manic disorder. Okay, so
Yes.
once a mental illness has developed, then there is a biological basis to the cause of the illness. There are neurohormones in our body, in our brain, which gets imbalanced, or there are deficiency or overproduction of some neurohormones due to which this mental illness occurs. So for example, if a person is suffering from, or his life events are, or his life situation is not good, there is a factor. For example, a person has recently lost his mother. There is sudden loss of the mother has died, and there is a sudden loss. So the person will undergo severe stress and sadness. We'll not call it depression at that point. We'll call it sadness. Okay. So
Yes.
in the initial stages, when the person is sad, at that point,
Yes.
if the person, we can replace the factor, we can
Yes. Yes.
replace the factor before the development of the mental illness, then that can be treated or addressed.
Possible.
But once the mental illness has developed, there is a
Okay.
time period. Okay, so after the mental illness has developed, there is a biological basis to its causation.
Okay.
For
Yes.
example,
Yes.
depression as well as bipolar affective disorder as well as manic disorders, all these have biological basis. Okay, there are some kind of abnormalities in the neurons or the neurohormones. Once that occurs, then only removing the factor will not make the patient completely cured. The
Okay. Okay.
medicine
Okay.
or therapy has to be given. Medicine or therapy has to be given to treat the person.
Yeah, I
And
would like
depending on the severity, so the person will, whether the person will recover shortly or he will take time or it will be lifelong, it will depend on the genetic susceptibility as the severity of the illness.
Okay.
So
Thank you.
here
Thank you so much.
I would also like to add,
Yes.
see, like in psychiatry, the treatment is multimodal and multidimensional. Okay, so as we
Yes.
all
Yes.
know,
Exactly.
there's no single factor to say that because of this the person is having the illness. It can be
Yes.
due to any factor. There's no, we only have theories regarding the cause of the illness. Okay, so
Yes.
we
Yes.
cannot say that you will catch it. It's not like you will do a CT scan or ultrasonography and then you'll catch it. Okay, the level is high, so give the medicine and it's done. Or remove it and it's done. It's not like that. So basically in psychiatry, it is multimodal where all the different teams will have to work together and of course, do the treatment per se.
Yes, exactly. Thank you. Thank you, Ansha.
Sir,
Yeah.
there are questions for you in the chat box. I would like to read out one question first. So one of the participants, he has raised one question asking you, who are involved in providing the telemana services?
Okay, telemanaged services, the first line, the first calls are received by counselors. So there are trained counselors on mental health. They first receive the calls. After evaluating the person, if they feel that the person may need more than counseling, then it is referred to either clinical psychologist or psychiatric social worker or psychiatric nurse. So these are the next level of mental health professionals. After the call is diverted to either of three of them, that is psychiatric nurse or psychiatric social worker or clinical psychologist, if they provide the therapy or the counseling, after that, if they feel that the person needs more than that and he or she may require treatment, medications and a consultation with psychiatrist, then the call is forwarded to a psychiatrist. So overall, there are counselors, there are clinical psychologists, there are psychiatric social worker, there are psychiatric nurse, and there is a psychiatrist in telemanas.
Okay. So I think it's clear now to the participants. So there is another question here. Madam Rumu Datta Chaudhary, she has asked, sir, I would like to know what is the chance of relapse of mental illness after complete treatment? Hello?
Okay. I got the question. So there is no concrete answer regarding this. So only statistics are available. So after, for example, a patient who suffered from schizophrenia, and suppose he required medications, and after taking 1 month of medication, if he stop taking the medication, then there are every chance that the person will relapse within 2 years of illness, within the initiation of 2 years of illness. So that is the chance. If after taking 2 years of treatment, the person stops taking medication and he is cured, even after that, there are every chance that after 5 years, he may or may not develop this schizophrenia again. So there are no concrete answer to it actually. So there are only chances or statistics available that there is always a 20% chance that after completion of the treatment course, the person may develop within 5 years or the person may relapse within 5 years. And it varies person to person. It varies person to person depending on the genetic susceptibility, depending on the familial environment, depending on the childhood experiences. It is actually a multimodal thing, multifactorial thing.
Yes. Sir, there is another question. So one of the participants has asked, sir, do the depressive patient have to take the medication for lifelong?
So, okay, there are severity of depression, major depressive disorder, mild, moderate, and severe. And even in severe, there are two categories, severe depression with psychosis, severe depression without psychosis. So mild and moderate depression, if the person takes and completes the course of medication, appropriate medication and therapy, it may be cognitive behavior therapy or other kind of therapy. If he completes, then the person may not require lifelong medication. But in the severe cases, there is always a chance that even after getting cured, if the person stops taking the medicine, in later life, if he faces some kind of stressor or some kind of major life event, then the depression may reoccur.
Okay. Thank you, sir. Sir, from my side, I just want to request you to repeat once regarding the provision of pension for the mentally ill clients that you have mentioned in your address.
Okay. So those person having mental illness and who are enlisted or who have the provision, the diseases which are enlisted in the this Disability Act, one of the diseases schizophrenia, then there is this severe bipolar affective disorder, then there are psychosis, all these conditions, and then mental retardation. These are conditions which makes a person disabled. His functionality is reduced. In such cases, the Social Justice Department has schemes under which the pension 1,000 rupees per month is given. But to avail that service, you have to visit the Joint Director Office. There is an office assistant who fills up a form on your behalf and upload it in the portal. There is a portal for that, uidai.gov.in, like that. I forgot exactly, but it is UIDAI. Okay, in that portal, the form is filled up. After the this form is filled up, the form is generated, and a nearby psychiatrist is assigned to that person. When the psychiatrist is assigned, you have to download that form, take the form to the psychiatrist in the OPD, and the psychiatrist will evaluate the person. After evaluation, the psychiatrist will decide whether the person is really disabled or not. If he is found to have disability, then the psychiatrist will give the score and certify the person. Then that form has to be submitted again to the Joint Director's Office, and after that, the form will be processed and the person will get the benefit.
I think so. This is done from the District Disability Center also.
Yeah.
It can be done. If like you have the district disability offices there, you can also go over there and avail the form from there.
Yeah,
like
exactly.
What we have been doing in our institute. So the patients, they get the forms from the disability office, and then they come to our institute where the psychiatrists, they review them, and then the certificate is then given to them,
Exactly.
after which they can go and monthly they can get a pension of 1,000 rupees per month.
Yes,
If
exactly.
I'm not mistaken.
Sir, there is another very important question. That is from Dr. Onita Dakwa, ma'am. She is asking which one is better, psychological counseling or medications?
Both.
Both are better.
Both are needed.
It depends actually, case by case it is different. So in mild to moderate cases, if the therapy is given by experts and it is followed very in a disciplined way by the patient, then only therapy can it will be effective. But in most cases, the therapy is not taken properly, so in most of the cases the medication is required. But if the therapy is in mild to moderate cases, if the therapy routine and the therapy is provided by an expert and the routine is followed strictly by the patient, then there is 100 more chances that he may recover only through therapy.
Here, say for example, if the person is having anxiety disorder, then
Yes.
only the therapy is enough. You do not need the medications. If you follow the therapy properly, then only the therapy will help you. But say, for example, you're having bipolar disorder, you're having schizophrenia, then you will be needing both. Because like medication adherence is one very big issue with the patient. So for there, the therapy is very much needed along with the medications for them to understand about their illness. Because until and unless the patient does not understand about his or her illness, until and unless the insight is not generated in the patient, they will not take the medication. So for the patient to take the medication also, they need to understand. And to understand that therapy is important. So both
But
goes equally.
there is a point here. So exactly, I agree with you. But the thing is, there are two categories of mental illness which was previously used. One is psychosis and the neurosis. So in psychosis, there is no point in giving therapy. The psychosis patient does not respond to therapy. Once the insight has come, then only we can give the therapy. So for the insight to come, we have to give medication actually.
Okay. So thank you so much, sir. It is so interesting. We were supposed to end up the session by 7 p.m. and it is going to be 7:30. All the participants.
I just want to add one small thing. One small thing, Mrs. Vita. I want to request all the participants not to use the term pagol or pagla. which is a very derogatory term. And in future, if you come across anyone using the term pagal hai, pagla hai, please correct. You learn and teach others also. This should, first and foremost, we should remove the stigma from us. Then only we can help others remove the stigma.
Yes.
Okay. Still, we are having questions. I think we have to stop here. Or Madam Gitumani is here. Okay,
Yeah,
sir, one
sir.
more question is there.
Okay.
One more question is here.
Okay, I can
So,
answer.
Yeah, sir. The question is, sir, will the person not be affected due to the intake of antidepressant for lifelong in old age?
So, okay, so this question is very subjective actually, because taking any kind of medication has its side effects, and we have to weigh the pros and cons of both the situation. Taking antidepressant lifelong, will it cause more side effect, or not taking antidepressant and suffering lifelong from depression, will it cause more side effects? We have to weigh the pros and cons of both the sides. So from my point of view, taking medication and suffering few side effects is better than suffering lifelong from a mental illness.
Yes. Exactly.
There will always be side effects from medications. So no question in that. So I don't want to propagate this wrong thing that the antipsychotics or antidepressant does not causes side effects or etc. But it will cause side effects, but it will be minimal, and we have to weigh the pros and cons of both the situations, and we have to decide by ourselves actually.
Benefit.
Okay. Thank you so much, sir. Thank you so much, ma'am, Dr. Anselama. And almost, I think we have come to the end of today's webinar. At last, I would like to introduce Madam Dr. Gitumani Kwar, who is the president of the Assam branch, National Nursing Teachers Association of India. Madam, would you like to say something at the end?
Thank you so much. So thanks to Gita that you have taken up such a wonderful topic, and it's very much fruitful. We can see the questions and all the participants, they have not dropped out in between the webinar, and all the speakers were so much enthusiastic to speak. I think if we can continue it for another 1 hour also, it will go on. So thank you so much, as I think we can make aware the people a little bit, at least 100 of them, and we ourselves also got aware, as we have also came to know many new things, and we will be able to spread these messages among other people. So I think we need some more webinars on this aspect. So I'd like to request Gita, so if possible, so that instead of taking up various different topics, we can choose this topic and work on this area, which is very essential for each and every one of us. So thank you once again. Thanks to all the speakers. We are really grateful to you all. You have spared your evening hours and spent with us and spent with the participant, sharing your knowledge. I wrestle out. So thank you so much. And Angshulama Madam, Burman sir, and Sisi Gogoi sir, thanks to you all again. Over to you, Gita.
Yeah. So thank you, madam. Thank you so much. So at last, I would like to say a few words to thank or express our gratitude to all the members associated with today's webinar. So at first, I would like to thank all the resource persons on behalf of the team of Nursing Teachers Association of India Assam branch to spare your time and enlighten us with your words of wisdom. We'd also like to thank the President Sir and Secretary Sir of Nursing Teachers Association of India for all the technical support. Special thanks to Madam Dr. Gitumani Kaur for motivating and pushing us to come up with this kind of activities and ideas. Thank you so much, ma'am. It was only because of you. I also would like to express my thanks to Madam Dr. Bandana Devi, who has helped and supported me all throughout to till this moment. Thank you so much, Madam Dr. Vandana Devi. And at last, I would like to express my heartfelt gratitude to all the participants for making this webinar a fruitful and successful one by attending it for nearly 1.5 hours continuously, for raising your questions, clearing your doubts. Thank you so much. Thank you, everyone.
Thank you.
So we can end here and hope to meet again. Thank you once again.
Yeah, thank you all.